I'm a little bit behind on these because, frankly, so busy with getting Invictus up and running. So we're calling one of them Baby Invictus, which is for the oral exams. And that puppy should be up soon. And then the big board review course, that we've got so many lectures and emphasis, and we're making question banks and summaries and coming along really, really well. We've got a great team, but it's going to take a little bit longer than we thought. You can go to invictus.reviews to check out the website, and then we'll convert this free podcast into a much more frequent and bigger and better. What I wanted to do this time was to get a little thing from Nort. He's our resident toxicologist, pharmacologist, and emergency physician. And he's going to talk about some really common household ingestions and whether they're bad or not. For example, household bleach. Kid drinks that, are they going to die? Or those little silica gel things that absorb the water and you find them all over the place. Kid eats those. What do you do for that? Plus some other stuff. It's a really short lecture and I love it. I love short lectures. It's like four minutes, but it has so many pearls in there that will come up in your practice every day. Ladies and gentlemen, Nort. The program is Invictus. This is the free podcast. Link below for the YouTube, which I think is actually more useful than the audio, but that's just me. And we'll talk to you soon. Herbert out.
Household chemicals. A 6-year-old accidentally drank a small amount of household bleach, 3% sodium hypochlorite, 30 minutes before presenting to the emergency department. She's asymptomatic other than she has a little bit of mild abdominal pain. What is the recommended treatment? Reassurance and discharge to home, give a little bit of milk to coat the mucosa, gastric lavage, or that's supposed to be activated charcoal. The answer is just reassure them and discharge to home. Now, I want to stress you have to make sure that this is household bleach because industrial bleach is going to have a much higher concentration. Speak to the poison center. The poison center leaves them at home. They never even send them in. So if the poison center sends them in, you do not have to do anything. And if you want to feel a little bit more comfortable, ask the poison center to follow up on the child later in the day, and they're usually very happy to do that. Here's a table of some very common household chemicals. I want you to think that most household chemicals like bleach, cosmetics, window cleaners, soaps, detergents, all these things are very, very safe. Minimally, if any toxicity, just call the poison center because most of them are just sent to home. So household bleach, and I stress household bleach because it's got to be lower concentration. Usually they just do fine. Cosmetics, they shouldn't have any problems with that. Window cleaner, you want to make sure that you find out what it is and speak to the poison center because very often you won't know, but these are usually safe. Any soaps or detergents, you usually do quite fine with that. Now we do worry about some of the pods, so the laundry pods. These can sometimes cause not only a little bit more of a caustic burn, but sometimes obtundation. So again, just speak to the poison center or your toxicologist. And silica gel, this freaks everybody out, particularly a parent, because those little packets that are in shoes and things like that, it's a desiccant and it says do not eat, but it's super, super safe. But you just want to make sure that it's no longer in the child's mouth because we don't want it to be a choking hazard.